spend in a miserable way.
U.S. News. Michael Bloomberg says 2020 presidential rival Kamala Harris Medicare for all would bankrupt. Michael Bloomberg has claimed that a senior Kamala Harris, the former mayor who is considering running for the Democratic presidential nomination, rejected the idea endorsed by his 2020 rival, which is gaining traction in the party. I think he could never afford that. You're talking about. Michael Bloomberg, pictured at a political swing in New Hampshire yesterday, has claimed abolishing private health insurance in favor of Medicare for all would bankrupt the country. The former New York City mayor, who's considering running for the 2020 presidential election, said the move would cost trillions of dollars. He proposed to provide, "I think you can have Medicare." While Bloomberg is considering running on a centrist position, the Harris carved out a liberal platform on Monday night, telling an audience of Iowa Democrats that the United States should eliminate all private plans and move everyone to a single-payer system. "We need to have Medicare for all. That's just the bottom. The idea is that everyone gets access to medical care, and you don't have to go through the process of going through an insurance company, having them give you approval, going through the paperwork, all of the delay that may require," she explained, concluding that private insurers should not be part of the system. Senator Kamala Harris of California made her first town hall appearance as a Democratic presidential candidate on Monday, saying she wants to abolish private health insurance. Harris spoke with reporters at Drake University on Monday night after the town hall event, hosted by CNN's Jake Tapper. "Let's eliminate all of that. Let's move on." Republicans were quick to mock what they typically call socialized medicine, something that has become more mainstream in the Democratic Party since the early part of the 2016 presidential campaign cycle. GOP spokesman Michael Arons tweeted a dig at Harris that also doubled as a jab at former President Barack Obama's frequent promises about his namesake health law. "Dems in 2009, if you like your plan, you can keep it," Arons mocked. Dems in 2000. Harris is advocating a Medicare for all platform that would put government agencies in charge of health coverage. That's an approach. Harris also defended other positions she took as California's Attorney General that are unpopular with some Democrats, saying at the Drake University event in Des Moines that they reflected her duty as the state's top law enforcement officer. CNN anchor Jake Tapper asked her about prosecuting death penalty cases, and about legislation requiring her office to investigate all fatal police-related shootings. Harris, who was Attorney General from 2011 until she became a U.S. Senator in 2017, said she enforced the death penalty despite opposing it. Who pays and how? Each of the 13 provincial or territorial governments provides insurance called Medicare, which can be used universally, with doctors or other providers billing the government insurance scheme for treatment. Almost all hospitals by August 2017. Healthcare spending per capita $4,826. Percentage of GDP spent on healthcare 10.5%. Percentage of healthcare spending by government 70.5%. Life expectancy 81.9. Infant mortality deaths per thousand before age of 1 4.58. What supporters say. Income is not a factor in the quality of treatment. Prescription drug, what critics say. Wait times are used to ration care. Mental health care, United Kingdom. Who pays and how National Health Service NHS is free at the point of access throughout the UK for primary, hospital and outpatient care. It is funded by Numbers 2017. Healthcare spending per capita $4,246. Percentage of GDP spent on healthcare 9.7%. Percentage of healthcare spending by government 79.4%. Life expectancy 80.8. Infant mortality deaths per thousand before age of 1 4.3. What supporters say. UK income is not a factor in the quality of treatment. Healthcare is not what critics say. UK care is rationed by waiting time and shortages. Health outcomes, who pays and how are. Hospitals, doctors and other healthcare providers bill insurance companies or providers for care of those with insurance. Private insurance, by the numbers 2017-8. Healthcare spending per capita $10,224. Percentage of GDP spent on healthcare 17.3%. Percentage of all healthcare spending by government 64.7%. Life expectancy 80.0. Infant mortality AA deaths per 1,000 before age 1 5.88. What supporters say. More effective treatments are incentives by letting people choose where they are treated. Innovation is what critics say. Millions live without insurance. Millions more cannot. Sources: Kaiser Family Foundation, the World Bank, the CIA Factbook, Organization for Economic Cooperation and Development. The comments below have not been moderated. By posting your comment you agree to our. Do you want to automatically post your Mail Online comments to your Facebook timeline? Your comment will be posted to Mail Online as usual. Do you want to automatically post your Mail Online comments to your Facebook timeline? Your comment will be posted to Mail Online as usual. We will automatically post your comment and a link to the news story to your Facebook timeline at the same time it is posted on Mail Online. To do this you can choose on each post whether you would like it to be posted to Facebook. Your details from published by Associated Newspapers Limited. Part of the Daily Mail, the Mail on Sunday Metro Media Group.
Raindrop, drop top, top smoking, no cooking the hot pot. Fucking on your bitch, yeah, that. Looking up, open the park pot.